Mr. President.
Senator from Florida.
Mr. President, I rise today to talk about issues very similar to my friend from Texas and echo his concerns about the current proposal for health care. We have found out yesterday that the proposal that was put forth by the Speaker of the House is nearly 2,000 pages. It's a $1 trillion proposal. That's $500 million per page. Sort of staggering to think about. But, Mr. President, when I came here to Washington just a couple months ago, appointed by my governor, Charlie Crist, in Florida, it was my cause to come here to be a problem solver, to help to work on issues that both Republicans and Democrats could work on together. And I learned this from my governor, Charlie Crist, that there are lots of issues that we can disagree about principally, but there are plenty of issues that we can work on together to do things right for the people. Now, that may not be in vogue in Washington, D.C. It may not be in vogue, Mr. President, to try to find issues, the low-hanging fruit, that we can work on together to solve problems, but it's something that I want to pursue. Additionally, when I came here, I recognized, and I spoke last week in my first address in this august body, that there are lots of times that most folks here in Congress would like to discuss grand new plans, grand new ideas for the future of this country. That's exciting to talk about a new program or a new administration, more government employees working on a new program, perhaps in some new government building. But I don't have a passion for necessarily following up on those great ideas for future plans, Mr. President. I have a passion for helping us do what we do better. And oftentimes in government, that's not the case. But we spend billions, trillions of dollars a year on existing government programs. Oftentimes, we don't do it effectively and efficiently. If we spend as much time worrying about the money that we're spending now, as opposed to the money that some in this chamber want to spend, I suspect we could find plenty of money to either return to the people or to find money for these new programs. And I want to talk today, Mr. President, about such an idea to recover some of the waste, fraud, and abuse that is currently happening in our system of government. We know that in our current provision of health care, in Medicare and Medicaid, that there is tremendous waste, fraud, and abuse. Estimates are some $60 billion to a staggering $226 billion a year is lost in Medicare and Medicaid to waste, fraud, and abuse. Now, this health care proposal that was put forward by Speaker Pelosi and that we're discussing here in the Senate, just for comparison purposes, is $1 trillion over 10 years. Now, I think anybody who's watched the government knows that if you estimate it's going to be $1 trillion, it's going to be a whole lot more than that if it actually gets implemented, because we don't do much in government that comes in under our estimates. Oftentimes, most times, almost every time, it's a lot more than is estimated. But let's just compare these numbers. $1 trillion over 10 years, that's about $100 billion a year. We may be wasting $226 billion a year already in Medicare and Medicaid. If we captured just half of that, we might be able to pay for this program. Better still, we could take those dollars that we're wasting in fraud and abuse, and we could put them back into the Medicare program to pay for health care for seniors. Wouldn't that be a good idea? Because the estimates tell us that in 8 years, we're going to be in a situation in Medicare where we're going to be in a deficit. We're going to be taking in less money than we need to spend. Workers will be paying in less than retirees need for their health care. So we as a federal government will have to shore up Medicare, certainly at that point. So why don't we concentrate now while we can on an issue that Democrats and Republicans can agree upon, which is trying to stop waste, fraud, and abuse. Mr. President, I had the honor yesterday of filing my first bill here in the United States Senate, Senate Bill 2128. I want to talk to the Senate today and the American people about that bill. Senate Bill 2128 is the Prevent Health Care Fraud Act of 2009. And what this bill simply will do is try to go after the waste in the health care system that the government currently runs. Mr. President, it is estimated that 1 out of every $7 that we spend on health care for seniors is captured by criminals or is wasted and is not going to help seniors. 1 out of every $7. That's where we get to that number of potentially $226 billion a year. I have a lot of experience in this, Mr. President, but before coming to the United States Senate, I had an opportunity to serve as the Deputy Attorney General in Florida and to run under then Attorney General Charlie Crist an office of about 400 lawyers. And within that office, we had a Medicaid fraud control unit where we focused on fraud in Medicaid. We were able to recover $100 million a year just in Florida by stepping up enforcement actions to capture bad guys who were taking dollars out of the system. Well, what we're going to try to do here with this new act in Senate Bill 2128, the Prevent Healthcare Fraud Act of 2009, is not just go after these bad guys once we figured out that they have taken the money, but is prevent them from getting the money in the first place. The American people would be shocked to know how little we do to prevent healthcare fraud. You would expect, sitting at home in your home in Orlando or wherever you are in the country listening to this address today, that we have a very comprehensive system to stop healthcare fraud. That if the government is spending billions of dollars, trillions of dollars over time on healthcare, that we would have hundreds and thousands of people who would be working to stop healthcare fraud. We would have sophisticated computer models that stopped healthcare fraud before it happened. Mr. President, it's simply not true. So we have introduced this bill yesterday, and I'm speaking about it today, to help try to stop this fraud before it stops. In my goal, Mr. President, to be a problem solver here in Washington, to work on issues that everybody can agree about. So let me tell you about what Senate Bill 2128 does. It does three things, basically. We are going to create within the Department of Health and Human Services, a deputy secretary who will be the chief healthcare fraud prevention officer of the United States. They will be in a number 2 role in that agency. They will report directly to the secretary. They will be confirmed by the President of the United States. And they're not going to have 7 jobs, Mr. President. They're going to have 1 job. Their job is going to be to prevent healthcare fraud. And if they don't do their job, they're going to come in front of this Senate, come in front of the House of Representatives, and we're going to call them on the carpet if they're not doing their job. And this secretary, this chief healthcare fraud prevention officer of the United States is going to run a division that is going to work every day to stop this healthcare fraud before it starts. And how are they going to do it? Well, oftentimes, Mr. President, the private sector gives us a model that we can use, that we can copy in the government to help us prevent healthcare fraud or anything that we do in government to do it more efficiently and more effectively. So what model is there out there to prevent fraud that's being used every day, that affects all of our lives, that stops fraud before it starts? That model is the credit card business, a business that is roughly the same size as the healthcare business. A couple $1 trillion a year passes through the exchange of money, through the purchase of goods and services, through credit cards. The healthcare industry is a multi-trillion-dollar a year industry as well. Now, the level of fraud in the healthcare industry is 1 out of every $7. The incidence of fraud in the credit card industry is 7 cents for every $100. 1 out of every $7 versus 7 cents for every $100. How do they do it? Well, we all have had this experience. You use your credit card to purchase something, and then a couple of minutes later you get a phone call or an email that says, did you really authorize the purchase that just happened over your credit card? Mr. President, it just happened to me a week ago. I went and bought a television here in Washington, D.C. at Best Buy. I have my family up here so they can be close to me during this time in the Senate. We have to have a television. So I go to Best Buy, use my credit card, I walk out the door, my BlackBerry vibrates, there's an email from my credit card company saying, did you buy and authorize the purchase of a television at Best Buy? Now, why did that happen? They have a computer modeling predictive system that says, this is a questionable transaction. George lives in Tallahassee, Florida. Someone's using his credit card to buy a television, which is something that's probably bought a lot of times when a credit card's stolen. Something's up, the computer, no person does this, this has been programmed. The computer goes into action, I get an email. Guess what? That transaction is not authorized for payment until I call my credit card company and tell them, yes, I actually authorized that purchase. Well, why can't we do the same thing that credit card companies are doing for healthcare? Why can't we use a predictive modeling system that says that a healthcare claim is not going to be paid when a red flag comes up. Right now, we're on a pay-and-chase system. We pay these people who provide health care allegedly, a lot of whom are not providing health care. A good portion of them are criminals, frankly, Mr. President. And we pay them, and then we try to go after them and enforce it, and we barely ever capture the money back. We capture some, but not near enough. We put this model in place, and it stops the fraud before it happens. So this legislation, Senate Bill 2128, the Prevent Healthcare Fraud Act of 2009, would put this predictive modeling system in. The federal government would have to go out and hire folks to do this. We'd have a competitively bid process. It's no different than what we do in other parts of the government. In the Defense Department, you have to go through a bunch of different checks and things before there's an acquisition of something for the Defense Department. Why can't we put this predictive modeling system in over in healthcare to use real-time data to stop these fraudulent transactions before they happen? According to Harvard University professor Malcolm Sparrow, the credit card industry establishes benchmarks for acceptable business risk, and their threshold is 0.1%. By contrast, fraud losses in the healthcare business run from 3 to 14%. That's 100 times the acceptable business risk. Another thing that this bill does, Mr. President, is it requires background checks for all healthcare providers. If you're supposedly providing health care, whether you're providing a wheelchair or actual health care services of going to a doctor, going to someone who's a physician's assistant, whatever it may be, if those folks are reimbursing the federal government to get paid for the health care that they're providing, they should not be criminals. You would think right now that we're doing background checks on all these health care providers. We're not. And I know this specifically, Mr. President, because Florida, unfortunately, is ground zero for health care fraud. We have tremendous problems in Florida, especially South Florida, where I'm from, down in the southeast part of Florida, Fort Lauderdale, Miami-Dade County, with health care fraud. Let me give you some examples. 60 Minutes last week aired a special on this. They talked about this rampant fraud in South Florida. One of the perpetrators was responsible for $20 million of health care fraud alone. And he said, quote, "We get a book of Medicare codes, and our bidder tells us which one of us to use, and we just run the codes. So they get one wheelchair and they sell it 1,000 times and get reimbursed 1,000 times for it. And there's no computer modeling system that puts the red flag up like it would be on your credit card and stops that and says, wait a minute, after the third wheelchair is sold in 60 seconds, maybe we should not pay this guy's claim." And Mr. President, it has gotten so easy to steal money from the federal government that organized crime has gotten involved. There's been stories of a Russian-Armenian organized crime ring that defrauded Medicare by $20 million. And they said it was easier than trying to be involved in the illicit drug business because there was no one going after them. Now, I want to take a moment, Mr. President, to applaud my colleague from Delaware, Senator Kaufman. He just introduced some legislation called the Healthcare Fraud Enforcement Act of 2009 to increase the penalties for healthcare fraud. And I think that that's great. We should be doing that. But in combination with that, we should do what we propose here in Senate Bill 2128, which is to stop the fraud before it happens. These instances of fraud across the country are rampant. I'll give you another example. South Florida is home to 8% of the nation's AIDS patients. 72% of federal AIDS medication payments are paid in South Florida. 72% when we only have 8% of the patients. Why is this happening? These medications for AIDS are extremely expensive. Some bad guy just runs the code all day and says, I've given this many injections of AIDS medication at $2,500 a pop, runs 1,000 codes, and we pay them. We pay them, Mr. President. It makes no sense to me. So, Mr. President, we've had big disagreements about how we're going to solve health care, how we're going to provide more affordable health care to our people in this country, how we're going to provide more access to health care. But we certainly can agree that we should run whatever program we have efficiently and effectively. We could certainly agree, Mr. President, that we should not have waste, fraud, and abuse. And if we can cut out $60 billion to more than $200 billion a year by simply putting somebody in charge of healthcare fraud prevention, put predictive modeling in like we have in the credit card business, and not let people be healthcare providers unless they have a background check, and if they're a criminal, not let them provide healthcare, we can save billions of dollars. And those dollars can go back into Medicare, which is running a deficit. Mr. President, it is very, as I said when I opened my remarks today, it is very much in vogue in Washington to propose grand new plans. And I understand that. But we need to be focused and have as much zeal about grand new plans as running the programs we have efficiently, effectively. So I hope that my colleagues will join me in supporting this piece of legislation, Senate Bill 2128, the Prevent Healthcare Fraud Act of 2009. And with that, Mr. President, I yield the floor, and I suggest the absence of a quorum.
The clerk will call the roll.
Mr. Akaka.